Hi everyone, this is Neel Raithatha, consultant audiologist and director of Curette. Thank you for joining me in my latest video using the Microsuction endoscope. And here we have a patient who attended with a fully blocked right ear. And as you can see, they've got quite a narrow opening to the ear canal. However, once you've entered the ear canal, it's quite large and cylindrical. Normally, our ear canals take on an oval shape, with the height being greater than the width. But in this patient, you'll see once I get all the wax out, they've got a very circular ear canal. And the main challenge with this patient is just dilating and distending the entrance of the ear canal to gain access into their ear. And you may have seen there also, they've got quite a few terminal hairs protruding from the first bend. And at times, this was slightly obscuring the view, particularly when I put the oil in. So when we put some oil in to soften this wax and change the consistency, some of the oil can coat these hairs. And it can occasionally get a bit blurry, but we still managed. I do suction those hairs. I don't actually add it into the final edit, and also dry them with some soft tissue or cotton wool just at the entrance. But inevitably there's going to be some oil, particularly when the oil has seeped a bit deep, and when you're suctioning it, the oil gets attracted to the suction, of course, and some of it, as I'm dragging it out, like this piece of wax, when you're taking out some oily wax from the entrance, it's going to coat those hairs. But all in all, we managed. Now, the hairs normally, you can see on the right hand side there's no hairs there, so they normally protrude outwards from the first bend, and the hairs almost exclusively, well, not almost, they are exclusively located on the outer third of the ear canal, the cartilaginous portion, and they're there for a reason. But prior to explaining that, I'll explain the anatomy of the outer third of the ear canal, where the hairs are located. Now, again, many of you have been watching my channel for a long time, you'll be aware of this, but for anyone new, so the outer third of the ear canal is made up of cartilage, whereas the inner 2/3 is made up of bone, so that's the osseous portion. And the skin that lines the cartilaginous portion of the ear canal, it has 3 layers. It has the epidermis layer, the outermost superficial layer. Then it has the dermis layer, and the dermis layer contains hair follicles from where these hair strands protrude from. It also consists of collagen, elastin, the blood supply, and some nerves. And then, last but not least, you've got the innermost, deepest layer, which is the subcutaneous or hypodermis layer, and predominantly that's composed of adipose fatty tissue. Now, in stark contrast, the osseous portion of the ear canal, the inner 2/3, it only has the outermost layer of skin, the superficial layer of skin, the epidermal layer of skin. Therefore, there's no hair follicles on the bony part of the ear canal. Hence why you should only find the hairs on the outer third. And these hairs are what we call terminal hairs. So there's 2 types of hairs that we have. You have vellus hairs, and they're like peach-like hairs. So they're very thin, almost invisible. And you do actually find some vellus hairs on your pinna. So the pinna is the elastic cartilage that resembles a satellite dish on either side of our ears. If you look very closely, you'll see these very, very minute hairs sticking out from them. And the main purpose of vellus hairs is it's more to do with thermoregulation. It helps to trap air in between the hairs, and it then warms the air as a result. So it can help keep the skin and different parts of the body warm. And it also, they secrete sebum from the sebaceous glands, and sebum is an oily lipid secretion which is designed to help moisturize the skin, provide its acid mantle to inhibit harmful neutrophilic bacterial infections. The terminal hairs have a slightly different function. They're more like protective hairs. So in the case of the ear, these hairs are there to kind of deter insects, creepy crawlies from entering the ear. So they provide this almost like a barbed wire effect. And interestingly, they are slightly differently arranged in the outer third of the ear canal. So right near the entrance, these hairs tend to protrude. As you can see, they spike out. But as you enter deeper into the inner third of that, the outer third of the ear canal, the hairs are more flatly arranged, so they're more up against the canal wall. So it's just an interesting difference there in the arrangement of these hairs. So I know some people, well, none of us like the hairs there in terms of when you're viewing, can protrude the way. So in the past, I've tried to trim with different varying levels of success, and I occasionally have to pluck them. I think plucking them sometimes is more effective, but if they're not causing me a problem, I tend to leave them. There is a few cases. I tend not to upload a lot of the ones with the hairs because I know a lot of people don't enjoy wearing them, but in comparison, this is nothing. There's a couple of videos, and I will search through my archive and get them out. And it's when it's like a forest in there, and it's very difficult to view. And in those cases, I do sometimes pluck. So yeah, I'll try and find them and upload them in the next couple of weeks, hopefully. And when you're using an endoscope, what we are using the endoscope not only to visualize the earwax, but we're also using the side of the endoscope to stretch open the ear. So where these hairs are, the first bend, where in the case of this patient's right ear, I'm actually using the left-hand side of the endoscope as almost like a door stopper. I'm putting it adjacent, parallel to the first bend, and then I'm pushing the left-hand side of the endoscope to the left, to just like I'm here, pushing the cartilage to the left, which then opens up the ear. So if you've got loads of hairs in that region, naturally, you're going to see some of them. And also if the wax is right up against the first bend, when you're using the endoscope to dilate open the ear canal, you're going to get a really zoomed in view of the wax. So, now the consistency of this wax is, it's slightly soft, and I think I've used the ear hook already, and I'm going to eventually I do remove it with a combination of ear hook and the Curette. But with the ear hook, initially it was just cutting through it. So, although there's not much opening there, because of the design of the right ear hook, I'm able to glide it right in between earwax that's up against the canal wall. It's got a streamlined profile, and it's got a tapered tip. But I think it's the Curette that I really need now. Here's the Curette. Initially, I just want to remove this outer blob of wax, if you want to call it of that. And as I'm bringing it through, it's getting trapped. Because the endoscope is no longer dilating open the ear, it's getting trapped at this narrow. And so where this wax is formed in the inner 2/3 of the ear canal, I would say the ear canal diameter is probably 3 or 4 times wider, maybe even 5, than the entrance of the ear. So the wax that accumulated there is into a plug. When we're bringing it through the entrance, naturally it's going to be a bit of resistance because the entrance of the ear is narrow, especially when I'm having to remove the endoscope to then, as I am here, to bring the wax out. Otherwise the wax will just hit the endoscope. So I'm just reaching deeper and deeper into the ear with the Curette. So this is the right Curette. I'm just leveraging it out. I've got a little bit left, so this is half hanging out the ear now. But I want to go in and behind. And then as I'm bringing the Curette out, I'm navigating the curvature of the ear. So I'm bringing the Curette from left to right as I'm coming out. And that's the big blob. So that's they've got a bit of laryngosclerosis, so some scar tissue posteriorly. Anteriorly, the eardrum's quite thin, but you would have seen that circular, more round shaped ear canal as opposed to it being an oval shape. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.